Hello students, it's me again, Miss Wood. I'm back here again to do administering medication by IV piggyback through a continuous line. So that's what we're going to do today. And if you print off your check sheets, just like with all the rest of them, we're just going to go straight by the check sheet, okay? So the goal is to administer medication via the intravenous route using sterile technique. So, okay? So again, we're going to check our doctor's orders. And we're going to check them carefully. So our doctor has ordered Rocephin 1 gram IV piggyback per existing line. Okay, so, but we know the patient has a existing line. So we're going to clarify any inconsistencies. We've already looked and we know that our patient has no known drug allergies, so they're not allergic to the medication. And we would check to see why he would be getting an antibiotic if he has a elevated white count or the reason for it. Okay, so then we're going to wash our hands. Wash our hands, and we're going to gather our supplies. And the supplies we're going to need for this one is a pair of gloves, some alcohol preps, and you know I always keep alcohol preps in my pocket just in case I need them. Our medication, so our medication is Rocephin. So, and you know you're going to have to calculate the Rocephin to know what to put it in on the pump. So it's to go in over 20 minutes, and we'll have a little lecture about that, how to calculate those drugs for that. And then our secondary, because we're going to need a secondary because this is continuous, so we're going to already have a line hanging, so we don't have to worry about hanging a line because it's going to already be there. Although we have to check for the medication's expiration date, and we do have to check in our Davis Drug Guide to make sure that our medication is compatible with the medication, with whatever's already hanging in the patient's room. Plus, we need to make sure that our Rocephin that we're going to hang, that the rate that we calculate is appropriate rate. So in the Davis Drug Guide, it'll help us tell that. Okay, so we'll determine if the medication needs to be diluted. Pharmacy's already diluted it for us and got it in a nice little bag, so we can take that. But we want to make sure that it's the right amount of diluent, because this is normal saline. Make sure that it's the right amount of diluent and that it is the right kind of diluent. So for our medication, so you know, just because it comes from pharmacy, we still need to check it and make sure that we're given the medication appropriately. So we're going to prepare our medication in the medicine room, okay? So we take our bag of fluids, and we take our, remember we have to have a secondary set. So here's our secondary set. I've opened it, and we're going to have to maintain sterility. So we're going to maintain sterility. We're going to take off our cap, pop off our little cap on our medication. Wrong cap. Okay, maintain sterility, and then we're going to insert our spike, twisting back and forth in a twisting motion. Make sure that your clamp is turned off. Remember, we have to make sure our clamp is turned off. Turn it upside down or right side up.
Can you tell us how we'll know which port to put our spike in?
Okay, I'll tell you that. We'll know how to put our spike in the port that's closest to the bag that's hanging. Okay, so it's the it'll be sticking up out. It won't be in the pump. Okay, so that'll be the port that we put our this bag on.
And which port do we put our spike in? Is there one?
Oh, there's two ports. I'm sorry. There's this port right here that is medication administration. Okay, so you see that it's like, it just has a little where you would stick a needle in there and put medication in there. But this other port is actually open. So I would let me clamp it off, and I'll show you. When you pop off the lid, you actually have a hole. Okay, so that is because I've already spiked it, fluid will come out. But if you haven't spiked it yet and you turn it upside down, fluid will not come out. So you actually have to spike it first. So, and then make sure your clamp is turned off, and then fill your chamber. Okay, and then we're going to allow it to slowly run through. Slowly run through until it gets to the end of our tubing, and we just want it to come to the end of the tubing. Make sure that it's at the end of the tubing, and look at it closely, make sure there's no air bubbles in it, and therefore our medication is ready to go to our patient's room. So we're going to take our alcohol preps, and we're going to take our gloves, and we're going to take our medication, and we're going to roll our cart into our patient's room. Knock, knock, knock. So So as we introduce ourselves to the patient, we're also going to be telling the patient, washing our hands and explaining the procedure to the patient. The doctor has ordered you some antibiotic and want to give you some antibiotic through your existing line. We're not going to have to stick you. We're just going to hang it in the existing line that you have. And we're going to check our 2 identifiers, our patient's name and date of birth. We're going to ask our patient to state that, their name and date of birth, and then we're going to also scan our patient and make sure that the name and date of birth is on the computer is the same person that we're fixing to give medications to. We've checked our medication. We've done our calculations to find out how much we're going to put on the pump, and we're going to check it again, and we're 3 checks. Okay, so therefore we're going to hang our medication up. So and in that when we open that package, that secondary tubing, it has a device that helps with our primary bag to lower it so that this bag hangs by gravity and the fluid goes in by gravity. We will actually take one of our alcohol preps and clean the top port on our machine so that the primary is still running, and there's a port on the top, and we will actually we will actually attach our secondary to our primary on the top of the pump, so that when we get ready to open it, we can set the pump. So we will actually set our primary, whatever our primary is running, whatever rate it's running at. We will undo the undo it. It went in there. Undo the top and actually attach the secondary to the primary. Okay. I think it comes out. Okay. And before we turn it on, before we reset the secondary to come on, we're going to look and see we know that it's already running, so it shouldn't be infiltrated, but we still want to look at it and be sure that there's no redness, no edema in that area. The patient is not feeling any pain in that arm. Okay, and then the pump will be running. We'll put it on hold. We'll set to secondary. Okay, and then we'll put in the secondary medication, and we'll set the pump for whatever rate we determined when we did our calculations, and then we will let the secondary run. And then after the antibiotic or the medication is all infused, it will flip back over to the primary. Okay, so we'll make sure our patient is comfortable, make sure that his bed is low in lock position, side rails are up ×2, his call bell is within reach, and that he's not having any adverse effects to the medication as it's being in. So we'll and then we'll come back and check on him again in about 20-30 minutes when we know that the medication has all been gone in. So then we'll wash our hands and leave the patient's room, and then we will document. And we'll document the dose and the amount of the medication that we administered. You have the date and the time of the medication that was administered, the name and the dose of the medication, the location that the IV site was at, the appearance of the IV site before. So you want to make sure that you say that it was in good shape before you started the medication, and what it was like when you left. So therefore, when you come back to check on your patient, you'll know what your IV is supposed to look like. Okay, and then how the patient tolerated it. So that's it. Thank you very much.